Hi, my name is Jacqueline Borden. I am a Purdue Global University student, and I'm also a nurse for St. Luke's University Health Network, Visiting Nurse Association. I see patients in the home with a myriad of different comorbidities, and one of the comorbidities I'd like to talk about is how to educate your patient on their congestive heart failure disease. So in order to get started, I've developed a pre-test, a post-test, and also a PowerPoint for the patient so that when I go into the home, I can give them tools to look at, questions to answer so that they may understand their disease a little bit better. So for congestive heart failure, I start off by training them on how to manage their disease by looking at their diet, how they exercise, also how they're managing their disease on a daily basis. So I want to make sure that the patient understands that they need a working scale in the home, and they also need a working blood pressure cuff. Usually there's wrist cuffs that they can buy over the counter, or they can buy one for the arm that's automatic. So I want to make sure that they have that in the home. They can cognitively understand the disease and manage the disease, or if there is a caregiver in the home, you want to make sure that you're educating the caregiver too. So before I go any further, I just want to share the pre-test that I made for the patients. Okay. Okay. The first question on the pre-test is what type of foods have the highest amount of sodium? And I go over this in detail with them because you have to understand the patient's culture also, how they get their foods prepared, whether they're prepackaged foods or fresh foods. But one of the questions here is it canned soups, fresh vegetables, fresh fruits, or sliced meats and cheeses that have the highest amount of sodium? So you would think canned soups would. Campbell's canned soup has approximately 1,260 milligrams of salt in them. So you just want to make sure that the patient understands that they need to reduce their sodium intake. Do not use salt on your food, and also look at the prepackaged labels. It is okay to cancel follow-up appointments with your doctor. No, it is not okay. If you have transportation issues, you want to educate the patient on resources available to them to help them with their transportation. It is okay to skip my medication if I'm feeling well. No, it is not okay to skip medications. You need to follow the doctor's prescribed plan for your medications, and also you want to make sure that you're taking a medication list with you to each doctor's appointment so that they can clarify your medications, and if there's any reductions in your milligrams or any reductions in medications itself, that they can go over them with you at that appointment. One of the signs of congestive heart failure exacerbation is shortness of breath. That is correct. I should call my doctor if I gain how many pounds in a 24-hour period? Well, if you gain 3 pounds in a 24-hour period, you should call your doctor right away, whether it's the primary care physician or your cardiologist. CHF, shortness of breath, consists of choose all that apply. Huffing and puffing after walking across the room, that is correct. Rapid breathing after running a marathon? No. Sitting still and breathing rapidly? Correct. And then rapid breathing when climbing the stairs without a break? No, that's okay too. Abdominal distension is a sign of water weight gain? That is true. I should have an emergency plan in place if I experience chest pain? That is correct. I should call my doctor if I gain 5 pounds of weight in a week? That is correct. And eating fried foods is bad for congestive heart failure patients? That is correct. So that is the pre-test that I would give the patients. Then I also developed a PowerPoint, which I will share with you. So here's my PowerPoint that I would share with the patients on educating them about their disease also. So the first one tells them what congestive heart failure is. It's a disease which weakens the heart and reduces its ability to pump blood effectively through the body. This is a picture of the heart. the aorta, pulmonary artery, and so on and so forth. So you want to tell them they need to keep like a Bible of daily weight monitoring. So they want to weigh themselves in the morning. You want to teach them to do it right after they've gone to the bathroom and with the same clothes on each morning. So if they're in their pajamas every morning, they can do it with the pajamas, or they can just take their clothes off before they get into the shower and weigh themselves. You want to look at their weight. If they're gaining weight, then you need to educate them on calling the cardiologist or the primary care physician. So you want to call if there's 3-pound weight gain in a 24-hour period or 5 pounds in a week, like I said. You also want to have them monitor their blood pressure. They have to be aware of if their systolic, which is the top number of the blood pressure, is above 140 or the bottom number is above 86. You want to notify the physician right away. Shortness of breath can be caused by congestive heart failure, which causes blood to back up in the veins, which causes fluid to be pushed out into the tissue space. This causes swelling in the abdomen, legs, ankles, and feet. Sometimes you don't see it in the feet and the legs, you just see it in the abdomen. Sometimes you're not, the patient's not aware of this, so you can tell them, if you get up and you walk across the room and you feel short of breath, then you may have abdominal distension. One of the ways of knowing that is to look at the abdomen, see if the pants are tight or what have you, or weigh yourself in the morning. So you need to reiterate that they need to weigh daily. Make sure that the patient is educated on the scale that they're using. Make sure they can see it. Make sure that they can get up onto the scale. And if they need help, make sure there's a caregiver available to help them get onto the scale so that they're safe. And here's the blood pressure cuff too. So like I said, make sure they know how to use the blood pressure cuff. If they can't use the arm one, then they should get one that goes around the wrist. It's really easy to use. Make sure they know how to use it or the caregiver knows how to use it. So foods to avoid with congestive heart failure, you want to tell them to avoid high fat cuts of meat, fried foods, prepackaged foods, foods high in sodium. There's a fun fact. There's 2,300 milligrams of sodium in 1 teaspoon of salt. So that can give them an idea of when they're looking at the labels how much sodium is in what they're eating. You want to educate the patient to eat foods which are baked, broiled, grilled, or steamed. Emergency planning with the patient, you want to educate them on if there's no changes in their weight, they have a stable blood pressure and no noticeable shortness of breath, they're in the green. They don't have to call the doctor and they're doing well. If they're in the yellow, they call the cardiologist for noticeable weight gain, swelling in legs, ankles, and feet, abdominal distension, or a new dry cough. In the red, you want to educate them on either calling 911 or having someone take them to the emergency department. For consistent shortness of breath, increased weight gain, more than 5 pounds in a 24-hour period, I would say that they would need to go to the emergency room. Chest pain, persistent dry cough, and or increasing edema. You want to educate your patients on taking all prescribed medications. You want to have a caregiver fill a medication planner or the patient if they're cognitively able. Utilize a pharmacy that will bubble pack the medications for the patient. And work with the doctor on any changes. Keep a list of medications and take the list to the doctor's appointments for clarification of all medications. And before taking any medications not prescribed, ask your primary physician if the medication is okay to take. This also includes supplements. Keep all medical follow-up appointments. It's very important. If the patient is unable to, then you want to educate the patient on ways to get transportation, Lantavan, have a social worker involved so that they can fill out the forms required so that they can have the proper transportation. So congestive heart failure made easy, 5 top strategies for the patient. Take all prescribed medications, stay active, always report symptoms of exacerbation to your nurse or doctor, which is the abdomen or leg swelling, shortness of breath, increased weight gain, confusion, dizziness, anything like that. Keep a daily diary of your weight and blood pressure to take with you to every doctor visit, and then avoid fatty and high sodium foods. Then at the end of my Sorry. At the end of the teaching for my patient, I also developed a post-test, and I will share that with you. So here's the post-test. So you want to make sure that the patient is cognitively able to manage their disease. So you're going to ask them these 10 questions to see if they can answer correctly. If they can, then you know that they retain the information that you're trying to teach them. So 2,000 milligrams of sodium is less than 1 teaspoon of salt per day. That's correct. I should call my doctor if I develop a dry hacking cough that does not subside. That is correct. It is okay to have swelling in my legs, ankles, and feet. No, it is not okay. One of the signs of congestive heart failure exacerbation is shortness of breath, and that is correct. I should call my doctor if I have trouble sleeping when I lie flat. That is correct, because if you cannot lie flat and breathe correctly, it means that you may have abdominal water weight gain, which is pressing up on your diaphragm, making you more short of breath. So you would want to call the doctor. I should call my doctor if I have trouble. Oh, I just read that. Sorry. Some of the warning signs of CHF consist of, choose all that apply. Blue tint to the lips and skin, correct. Excessive sweating, correct. Loss of appetite, yes. Sleeping well at night, no. I should monitor my blood pressure and keep a daily record. That's correct. I should take my medication as prescribed. Correct. I should ask for help if I do not understand or require additional resources to manage my disease. Yes, correct. It is okay to accept help from caregivers to manage my congestive heart failure. That is correct also. So, they're the tools that I would use to educate my patient on this in-service for congestive heart failure. I also would reiterate this each time I see the patient, only because, as myself, sometimes I forget. So you want to make sure that they continue to manage their disease in the proper way. Like I said, culture, you want to make sure that if they tend to use a lot of salt in their foods, then you would educate them on adjusting how much sodium goes into their foods. Also, water intake. Sometimes the physician will tell them that they need to be on a water restriction or a fluid restriction to 12, usually it's 1,500 to 1,800 cc's of fluid daily. So if they are on the fluid restriction, you want to get out a cup and show the patient just how much water that they can have or how much fluid they can have in a day. So other than that, thank you for listening.